Children's Bureau. Child Welfare Evaluation Virtual Summit Series. Children's Bureau. The Child Welfare Evaluation Virtual Summit Series was made possible by the Children's Bureau. Getting it done, partnering to overcome concerns about data sharing. In animation, a boy stands between a man and a woman.
In child welfare, accountability and effectiveness are expected. As administrators, we're being asked more and more often to monitor our performance, evaluate our outcomes, and justify why our programs should continue to be funded. We're also being asked to partner with other agencies and systems that serve the same children and families to evaluate services and outcomes together. Many child welfare administrators know they need data from a variety of sources, but knowing where and how to get it can be a challenge. Sometimes this can feel like an impossible undertaking, and it's easy to feel overwhelmed.
I know I need to determine whether our program is working, but I really don't know what information I need, let alone who has it or how to get it. I don't know if we're even allowed to share our data or if others can share their data with us. And our information system is so old, we would probably have to build a whole new data collection system. We can't afford that now. Can my agency really do all this?
Despite feeling overwhelmed at times and uncertain about where to start, many child welfare agencies are finding ways to access and share the data they need. How are they getting it done? We'll talk about a few misperceptions and myths that sometimes deter us from sharing data, and how practical steps can be taken to overcome them. Let's examine a few of the most common barriers to data sharing more closely.
Data needs.
I really don't know what information I need, let alone who has it or how to get it.
Sometimes when we're uncertain about what data we really need, we assume that it's best to ask for everything. The truth is you don't need it all. In fact, you may only need a small amount of data for your analyses. By creating a process to identify those data elements we need right away, we can repeat the same process in the future if more information is necessary.
A boy holds up a key.
Let's say we need to evaluate the effectiveness of an independent living program for youth aging out of foster care that our agency has designed in collaboration with the local housing agency and the local school district. Each agency collects data about its own services, and each needs data from the other to know if the program is achieving the outcomes we're looking for. In this case, we want to know whether or not the program improved educational outcomes like high school graduation and housing outcomes like reduced homelessness. Our first step is to bring together program, evaluation, and IT staff from the housing, education, and child welfare agencies. While it can take time to build trust, partners in joint projects usually recognize the mutual benefits of sharing information and will make efforts to work together. Most child and family serving systems are under more pressure than ever to exchange information so that they can be more efficient and better assess needs and improve services. And many federally supported projects are contingent upon collaboration in order to receive funding. Once the key players are at the table, our next step is to identify the data elements we actually need, keeping in mind that not everything needs to be shared. What data we need depends on our evaluation questions and our ideas about how the program works and which factors could influence outcomes. For example, if the desired outcomes of our program are high school completion, stable housing, and self-sufficiency, we'll likely need a combination of demographic, school, housing, and child welfare information, as well as information about the youth's participation in independent living classes, employment training, and other services. Then we'll determine who has which data element, where it's housed, and whether each element can be identified with an individual child or family case. It's important to discuss common identifiers that are being collected by all agencies, like name, date of birth, and gender. In order for agencies to share data about individual cases, a unique identifier, or a combination of common identifiers used by all agencies must be matched. In some cases, agencies may need to adjust their data collection to make sure they're recording common identifiers in the same way. The partnering agencies must also identify information that is only collected by one agency but needed by the others and determine if this information needs to be person-specific or shared aggregately. By working together, we can identify what data is really needed, who has the data, and which data needs to be shared. Keep in mind that different information may be needed at different times during the program, and some may not be needed at all. Let's move on to another common area of concern.
Privacy.
I don't know if we're even allowed to share data, or if others can share their data with us.
Sometimes it feels like in order to preserve the confidentiality of clients, we can't share anything. But the truth is that while privacy is protected under a variety of laws, you can share confidential information under specific circumstances and with the appropriate legal, technical, and procedural protections in place. First and foremost, it's important to understand the law. We can't let ourselves or let others hide behind statutes to avoid sharing data. The Social Security Act, CAPTA, FERPA, and HIPAA all have provisions that protect privacy and restrict the use of data, but all allow for the exchange of data for certain purposes. For example, HIPAA allows the sharing of personal health information for treatment, payment, and healthcare operations. And recent changes to FERPA make it easier for schools to release a child's education records to child welfare agencies. But we need more than statute to ensure that we can legally and easily share information. We'll have to establish trust and negotiate terms of agreement between all the data sharing partners. Data sharing agreements should be sealed with formal memoranda of understanding. And our negotiations should be clear about what is being shared by each agency, outline any restrictions on the use of shared data, include safeguards against unauthorized access and disclosure of information, specify the roles and responsibilities of each partnering agency, and ensure that the agency's confidentiality requirements are enforced.
Two men shake hands.
We should also address technical issues such as how the data will be transmitted, encrypted, secured, stored, and accessed. Once a data sharing agreement, or MOU, is signed, then it's time for us to set up protocols and clear rules about who gets what types of data, how and when they can access it, and what types of training are needed to make the most of it. If our program, legal, and IT staff have all been involved, trained, and understand the agreed-upon limitations and permissions of sharing data, we should feel confident in our ability to share data and to request data from others. Now that we have the processes and protections in place, it's time to revisit concerns about technology.
Our information system is so old, we probably have to build a whole new data collection system.
Technology.
When our current information system doesn't seem capable of meeting our data needs, it can sometimes cause us to throw up our hands. But starting over from scratch and creating a new system is often only one of several options available. Let's not assume that we need an entirely new system to do the job without doing a thorough assessment first. This means working with our IT staff and involving them from the beginning. In some cases, a new system may be the more economical and efficient choice, but often an older system will still be able to support our needs. Old dogs can learn new tricks, and our old system may be capable of new tricks too, and it may not be all that hard to do. Our IT staff can propose a variety of options, taking into account the existing system's capacity, cost, and the staff burden of additional data entry. We might hear some of the following suggestions for data sharing between the Child Welfare Agency, Housing Authority, and school district.
One option might be to create a separate integrated data warehouse, where all of the partnering agencies could dump their data files. Then the data could be merged behind the scenes.
We could also create a standardized data exchange between the systems, so that certain data elements would be defined and used the same way by all of the systems.
Or we could upgrade our existing child welfare data system to allow housing and education data to be imported.
By not limiting ourselves to slashing and rebuilding anew, and consulting with our IT experts, we can explore our options, make more informed decisions, and create a collaborative process that may result in less drastic approaches, and maybe even less stress. While it can seem overwhelming, the truth is that we don't need everything. Data can be shared while protecting privacy, and creating a new system isn't the only answer. So to answer the question,
Can our agency really do all this?
the answer is yes. The processes of identifying the data we need, setting up data sharing agreements with appropriate protections, and investigating our data exchange options are all doable when we are willing to try and bring all of the right people to the table. Data sharing is not an impossible feat, and we are all up to the challenge.
A smiling woman gives a thumbs up. Credits follow. Special thanks Tammy White, Diane Carroll, Dory Snedden, Brian Deakins, Children's Bureau. This video was created by Paltech Inc. Child Welfare Evaluation Virtual Summit Series.